Maxine, Prabita and Robs are kindly representing physician associates. I think what's really important to say at this point, I think our group are so kind to present together. We're not pitching one against the other, or we're not saying one is better or worse, but this is a great message to say, look at the potential you've got. We're not saying do this or do that, but look at this fabulous potential that we can look and choose from in our future. I'm going to hand over to who's going to start.
So my name's Ros, I'm a physician associate in practice. My name's Ros, I'm a physician associate in practice. This is Prabita and Maxine, who are physician associate students. So they're going to talk to you first about the type of training that they're going through at the moment, and then I'll go on to talk about PAs in practice.
Hi, so I'm Maxine, and I'm a second year physician associate student. So the PA course is quite new in the UK, but it's been in America for about 60 years or so. And it started off in St. George's and some unis up north, and now it's kind of all over the country. And in terms of Kent, we've got the school of Kent, Surrey and Sussex, and there's PA students all over there as well. So basically, I've got an undergraduate degree in biomedical science. And
I'm got degree in nursing as well.
Yeah. So and then plus healthcare experience. So we've both had experience working in hospitals and stuff. And our colleagues have also got varied healthcare experience. And then we decided to apply for the course. So the course is a 2-year intensive postgraduate diploma, and some places also do it as masters. So yeah. So we work according to this matrix, and basically the idea is that once we finish our training, PAs are we are dependent practitioners, so we work alongside a supervisor, but we are trained to diagnose and manage like core common conditions, and so we've got different the conditions have been split up into different categories. We've got like 1A and 1B and stuff. So basically, it's just saying that we will be able to diagnose and manage like these conditions, which are like 1A, and then the more like slightly more complex conditions in the 2A and 2B. Then it just means that like especially if we haven't seen it, then maybe it's already been diagnosed and a management plan has been suggested, so then we can sort of follow up on that. So as part of uni as well, then we do placements. So last year we did 1 day a week every Wednesday in GP practice. And then when we finished, we went to hospital, did general medicine, and then this year we've done quite a few placements in secondary care. So we've done acute medicine, obs and gynae, A&E, mental health. So all these placements sort of give us like a generalist knowledge, and I think that's quite useful, like to help within GP surgery.
And also when we go second year and GP practice, we're doing full-time placement in second year. So that's quite good experience when we are in practice. So now I've got 30 minutes consultation time. I can see my patient easily when I exposure to all this vast majority of experience in secondary care. And also we got a board exam. University does regular exams weekly. We got multiple choice questions, single best answers, essays, and everything we have to do within our 2 years program, and to able to pass and get the clinical experience, everything we have to submit to the FPA board, Faculty of Physician Associate. And in the final board exam, we got single best answer questions, 200 questions, 4 hours exams, and 14 station OSCEs as well. So once we pass all those exams, then we are qualified PA and registered as under Faculty of Physician Associate voluntary registration. That will give us eligibility to practice in either primary care or secondary care as well. So, as a physician associate role in primary practice, under supervision of a GP, we can do, we are generalist practitioners, so we can work, do telephone triage, manage our own list, ordering investigation, home visit, liaise with the other clinical teams for referrals, and also procedures if we get a more training and go for contraceptive procedures as well, and mother and baby checks, minor surgeries, and also assist GP with the DVLA forms, stuff like that, and later signed by GP as well. The qualified PAs at the moment doing all these tasks. As a student, I'm shadowing now with my GP with the home visit and doing contraceptive clinics as well. In typical my Mondays, morning 8:30 I start my clinics, till 12:30, then shadow with the home visit and afternoon clinics, and from 6 to 7:30 I shadow with the contraceptive clinic as well. So this gives us a chance to experience all available opportunities as a student, then future we can work in the practice. In future, obviously our limitations at the moment, prescription and radiations. Once they are working on it, once we got that opportunity, and we will upgrade our knowledge towards it. And at the moment we're studying and we are competent to do that, but we didn't have a right to prescribe. Once all that one authorized, we will be future prescribers and and right to radiation as well. And also we can help in special interest, especially women's health and all minor surgery. We can do the clinics in that way as well.
And some PAs also decide to take on like dealing with the costs and stuff, so then that can help practices keep on top of that.
Thank you.
Okay. Unfortunately, my slides haven't made it to the board. So, never start with an apology. I'm afraid I'm going to break that rule. My name is Ros Tucker. I'm actually a physician associate working in trauma and orthopaedics in Margate, so I don't work in general practice at all. Unfortunately, my colleague who does work in general practice has fallen sick. So now I'm trying to remember my slides now. So as the students quite rightly put it, it's a 2-year intensive programme postgraduate. They have to take university exams. There are many universities throughout the UK now giving a PA course. You need to take the university exam. After that, you actually have to take the national exam as well. The national exam consists of 2 papers of 100 MCQ questions each, and also a 14-station OSCE. The MCQs are based around, as they've quite rightly said, general clinical medicine. After you've completed your national exam, you're then allowed to apply to be on the PA Managed Voluntary Register, which is held by the Royal College of Physicians, Faculty of Physician Associates. So that's where we are at the moment, and this is very difficult without prompts.
Shall I prompt you? So do you want to just talk us about through regulation and where we are?
So regulation, there has been a consultation now with the government on AMPs. There's been a consultation of a number of roles, one of which is the physician associates, and we are expecting within hopefully months, maybe the next year, a result on that consultation that we will be regulated. What comes with regulation is prescribing rights and the ability to order radiology, which we can't do at the moment. Most people get round prescribing the way I'm sure you all have with nurse practitioners and other roles in your practice. We see the patient, make a decision, come to a decision, present the patient to you, and then if you feel what we've said is correct, we can fill out the prescription and get you to sign it. With experience, PAs can then will see more patients without presenting every single patient, and at the end of clinic maybe get their prescription signed, something like that.
And there was an initiative of a PA internship in Kent.
Yes, got loads of slides on that. So I actually run the Physician Associate Surgical and Emergency Medicine internship programme at Canterbury Christchurch University, and I'm now in collaboration with Cathy O'Leary, who's a GP leading on the GP internship programme. They're really good slides.
What we'll
Lots
do
of
is,
information.
I do apologise to everybody, but there's fantastic information. There's also loads of resource from all of the presenters that we've got, so we will make sure that there's a full pack that's sent out. So we can just make this very casual, and we'll make sure that there's a full pack sent out. And if it's okay with you, Ros, we'll send out the slides as well.
I've got a few key points written down, mainly that we're trained in the medical model. We can learn and develop in line with the practice needs and requirements and supplement the GP workforce. Over time, we build relationships with our GPs and build up that trust so that we can invest in the team. PAs have been working in general practice since 2003 in the UK. First of all, they came over from the US, and they've actually been in the US since the 1960s, and they're a very well-established profession there. I'll stop now, sorry. Happy to take questions.
What we'll do is we'll do it all at the end.